Hi, I'm Dr. Chris Rickards. I'm just going to talk to you a little bit about this, what's called photobiomodulation. Big annoying word, but the other terms for this technology which I'm going to speak to you about is photobiomodulation. It's the most recent name for it, PBM. It's also been known as low-level light therapy, low-level laser therapy. So it's gone by a few names. It's always done exactly the same thing, which is really just one thing. Now, before I get too far into this, anybody who has any interest in low-level light or PBM therapy, I really suggest that you learn what it does. On our website, we have a couple videos that will explain the mechanics and how this works, because it's very trying to just explain it to a layperson can be a little bit daunting. But when you see the animated videos that are created for this, it makes it pretty straightforward. It is really a simple concept, and what it does, some pretty profound things that there's really nothing else that we have available to us nowadays to accomplish. These things can, or they can accomplish things in much nicer ways, and I'll speak a little bit about that. So first of all, what photobiomodulation is it's a manner to get your body to heal faster and perform better. The way it does that is, in our body we have things called mitochondria, which are things that produce energy for our body. Over time, due to age, injury, and injury can very much include things like exercising, because that's really what you're doing. When you really work out hard, you're damaging muscle fibers, and then they have to repair. Whenever your body gets injured, it creates things like free radicals. You've heard of things called free radicals, and they say, okay, you take vitamins or antioxidants. It helps reduce free radicals, and that's true. And what free radicals are things produced in your cells typically as a result of injury. There are some beneficial things. Your body can use these free radicals to its advantage, but again, I don't want to get too deep in this in here just now. But so free radicals are the things that is the basis of aging and most disease processes. Actually, it's called oxidative stress, which produces these free radicals. That is considered to be the basis. If you look through most diseases, and whether it be MS, cancers, Alzheimer's, things, they'll virtually always say it appears that oxidative stress is an initiating factor, or factor that starts a whole cascade of events that result in different issues. It's as well as even aging and certain aspects of aging. What aging is cells performing less efficiently, dying, and again, oxidative stress is a major, if not the major culprit behind these things. So when we're talking about the low-level light or PBM therapy here, really what we're doing is PBM, what it does is it helps reduce oxidative stress, and it's very effective at doing that. The videos can explain to you the exact mechanism of that, which I won't start to do here because it really helps to see some drawings that go along with it. But let's take for a given that PBM does reduce oxidative stress. Now, when I say take that as a given, I'm not asking you just to believe me. There's, as in much of the brochures or marketing things that you can see from low-level laser companies, there's tons. There's like way over 400 university-controlled studies, like at MIT, Harvard, where actually one of the professors of Harvard, the medical school, is a big proponent of this. He's one of the Dr. Hamblin is very, very well known internationally on this, and I mean, it's not a question of does it do this. That's absolutely known, proven what it does. So that's not the issue. The issue is going to be, okay, well, we can reduce this oxidative stress in these circumstances either we're talking about it, say, for trials. How exactly do we do it? How much energy? Is it energy that is continuous light, or is it flashing light? And if it's flashing, at what hertz, at what frequency. There's ton, and how long, how much, how intense. There's many questions. What's an optimal dose to produce a result for a given situation. So this is what I'm getting at, is that the science behind it is extremely sound and very solid. Now, how we actually turn around and apply that to an individual's concerns is where the art of medicine or science comes into play, because you need to try and see and experiment. There's tons of studies out there for you name it. You have a problem, look up photobiomodulation or LLT and whatever your concern is, and you're going to find studies and people who've done things with it. So from my perspective, what's gotten me so interested in it is that, first of all, this type of science has been around since 1964. Very quickly, it was discovered that lasers were discovered in '64, and there was some gentleman in, I think it was Bulgaria, because it was in the Iron Curtain in those days, who was doing the studies on seeing if lasers going to cause cancer. So what they were doing was finding they had these mice shaven so that they could see the skin, and they were applying the laser to the skin to see if it's going to start doing some sort of bad stuff. And after a bunch of time, he noted, said, well, I haven't found anything bad other than it tends to be growing a lot more hair where we're using the laser. and that's kind of where it all started. Basically, that's why there's actually systems out there specifically for hair regeneration, and it does help. It absolutely does help and work. It's not a standalone thing. It's like almost every other disease that we come across, it's often multifactorial, but can something like a low-level laser help that? Well, absolutely it can, but that's just the tip of the iceberg. So they've made units for quite a number of years. There's a company that I've been using for the last 4 years, and it's thorlaser.com. I like them. They're built very nice quality units, which is something that to me shows not so much a pride in workmanship, but they take their things seriously, and they have so much studies and protocols behind them that it was my choice. Not saying that the other ones don't work, it's just this is the one I tend to use. Now, I got this originally for dental applications. This is a handpiece that's used on this particular low-level or PBM unit, and it can be used on, of course, we'll use it on patients who have, say, jaw joint problems. If somebody's in the office and I have a lot of problem opening up for a long time, you can use this across their muscles in the joint, and very quickly they're more comfortable. So we can see effects right away, and with some little applications like that as well. Things that we've never been able to really treat adequately before are dry mouth due to things like medications and again age. Now, the medications and age is doing this oxidative stress thing, shutting down your salivary glands, and when you use this, it starts to reverse that process, and then boom, you start getting saliva again. We've had patients go from absolutely zero saliva, and so it's been like that for like the last 20 years, to saying I can never remember having had so much saliva in my mouth, and going to completely normal. Of course, I would say on a yearly or every couple of years you'll need to top it up, because just like you got there in the first place, it's an aging process or it's a damaging process, and you got to sort of fight against it. But the procedures are completely painless, very easy. I mean, in the sense, it's so easy that it makes it hard to believe that it's actually going to do anything until you start getting saliva in your mouth. But it can also be good for, as I say, jaw joint issues is what we use it for. And then, of course, my interest sort of personally then went to say, well, I've got this shoulder that's really bothering me. I wonder if it's going to be good for that. And I go check to the site of this particular company. And they do have protocols, and I've used it. And just so that you know, I'm not completely off the wall here, is I was having issues with my shoulder. brother of mine's an orthopedic surgeon, so had MRIs, all of that. Yeah, you've got a classic rotator cuff situation. Don't want to operate on it. You're kind of young. Just try not to do the things that are aggravating it. Slowly exercise it, that sort of thing. The things that aggravate it, me playing hockey, that's not going to stop. So anyways, long story short, so I was using this on my own shoulder, and really within a couple treatments, completely stopped the pain. And that was years ago, and it's still fine. And so it really got my interest peaked, and on using it on other injuries and things for muscle recovery. These are personal stories, but for example, I had been exercising and both my legs were killing me. I mean, to the point where you just touch it and it's like, ah! And so I actually, just out of interest, treated one leg with low-level laser, the other leg did nothing. And then the following day, I was just getting a massage on my muscles, and the leg I did not treat was still very painful. It was just making lots of whining noises. But then when I had the leg that was treated, it was okay. You could do that, go ahead, do whatever you want. It just speeds up healing, is what it does. Again, I'm not going to go into too much of the actual dynamics, because that you can see on a video, but the best way to put it is people will say, when you've got oxidative stress, you get these free radicals. Take vitamins because they're good antioxidants, and that's true. A lot of skin creams and such will have antioxidant properties, and which is to try to slow down or stop or reverse this oxidative stress. And they use it on skin creams, and you'll find that your skin can actually be a little bit nicer. Vitamins and that. What the late does is exactly what excuse me. What the light does is exactly what the vitamins or antioxidants are trying to do. They're trying to get to the tissue that you need it to, and reduce the oxidative stress. The nice thing with the light is you put it there, it's there, and it does it very, very well, as opposed to being uncertain as to if you're taking vitamins, what else am I taking, is it getting to where I want it to. This, with the light, there are no known side effects other than if you shine a laser in your eyes, which we don't. So that's obviously, you just never shine a laser in somebody's eyes. You can use the LED in your eyes, and that's actually shown to be very helpful for things like macular degeneration. Lots of studies out there on it. And again, I wouldn't be saying that. It's just all of these things, look it up, and you'll find university-controlled studies on these topics. I've just found it to be so remarkably useful in so many ways that I'm kind of like a kid. I get very, very excited about this stuff. And then the company came out with a full body canopy, which is like a tanning bed, but does your whole body. Not as intense as these lights, or in this case, there are some lasers in here on different hand pieces. Not as intense, but it's your whole body all at once. And so that has become really available. They started becoming sold in March of 16. People, for example, who got on board very quickly was Nike, the sports company, and they have this thing called the Oregon Project in, of all places, Oregon. And what it's there to do is they're working with Olympic track members, team members, to try and win gold medals. And the way they're using the Thor canopy is to reduce their healing time, so they can work out really hard, and then instead of waiting 2 or 3 days, they can do it again the next day, and they'll heal faster. And just like as I was mentioning to you about when I had worked out, my legs were really, really sore. I did a little bit of light on one leg, nothing on the other, and the next day, the one that I did the light was so much better. I mean, I could have been working it again. So that's the idea with the canopy, is very, very exciting, and knowing exactly what it's going to do for you or to you is hard to say. The one thing is, I say on the positive side, there's no known side effects. I've never heard of anybody having anything negative about this. But for example, one client who's been using this was reporting that, gee, I always sleep poorly. I always wake up several times in the night, I did this once, and since then, for about a month, I was sleeping every night, right through 8 hours, no problems. And people were talking about having much less anxiety, better moods, sleeping better, things like the Oregon Project, or and if you again, they have testimonials, and you can watch videos on that, them talking about how it's affected their training. There's so many different things that this can do that I really just decided I wanted to have one of these for me because I'm getting older, and I figure if I can use this a couple times a week, it certainly should just help me what I'm hoping is age more gracefully and with less discomfort. One thing I found, I've had relatively minor back problems in the last number of years, and when I say minor, I mean just when I get up, I can feel it's a little bit tight here. Sometimes getting out of bed, up just a little bit of tightness. And I've been noticing that over the last, because I haven't had this even for a year yet, over the last number of months, as I get out of it, it's actually, I don't really notice that anymore. I don't have that tightness back there. I'm feeling way, way, way more comfortable. Things that other people I know who've been using them regularly will report that their skin is just nicer. Another client saying that she notices that and that her hair is growing. And I mentioned before that that's not a surprise. And so there's so many things that it can do. It's all positive, and it given the etiology or the origin of so many of the diseases that we're familiar with, that it actually works directly against that initiating factor of these many disease processes. It makes me think, well, that's something I'd like to be using a couple times a week, and that's why I have it, and I just want to make it available to others, because if it can truly make some of the people who have got more chronic pain issues, more general pain issues more comfortable, that would be awesome.